Penelope had the question about endometriosis and hormonal imbalance. From her understanding, endometriosis tends to create estrogen dominance. And yes, she's correct there. But in her case, she also has symptoms such as a lack of cervical mucus, especially in her follicular phase. And she thinks that's a sign of lack of estrogen. And then she also said she comes off a medication 5 months ago, so she understands her hormones may need a little bit of time to get back on track, but she's wondering how she can get a better understanding what's actually happening. Endometriosis can be very confusing on its own, but what is key to understand is that endo doesn't mean your whole body has tons of estrogen everywhere. Now it means the lesions and even the normal uterine lining often have extra estrogen receptors and can even make their own estrogen locally. So the disease is very estrogen sensitive in those spots, even if your actual blood estrogen isn't sky high. And even if other tissues like your cervix aren't getting the perfect signal. Now, when people say estrogen dominance, including me, we're usually talking about estrogen being high relative to progesterone and not being cleared well by the liver and gut. It does not mean estrogen is ideal in every single tissue or that it's rising in the right shape at the right time across the cycle. Now, cervical mucus in the first half of the cycle depends on a strong, well-timed estradiol rise. And that rising wave tells the cervical glands to switch on and then make that slippery egg white mucus. If that rise is weak, delayed, or just messy or all over the place, it can happen too. Or if the cervix itself is inflamed, which is very common when there's chronic pelvic inflammation with endometriosis. Now then we layer your medication on top called Ryeqo, and this works by suppressing your own ovarian estrogen and progesterone and then giving back sort of small doses to protect your bones and reduce hot flushes. And that means your natural brain-ovary conversation has been dialed right down for a while. When you stop that, your hypothalamus pituitary ovary axis has to literally reboot. Your brain has to start pulsing out its signals again. And the follicles have to grow properly. Estrogen has to build to a strong peak again, and ovulation has to fire again. And that can take several months, unfortunately. And during the reboot, it's very common to see weaker or mistimed estrogen peaks. Also, you might have no ovulation and softer ovulation signs. And yes, it shows up in your mucus. So if you are seeing endometriosis on your scan reports and this estrogen dominance is sort of talked about like I do all the time, really it doesn't mean your body is contradicting itself or that you're broken. It just means that different tissues are experiencing and responding to estrogen differently right now, and your hormones are coming out of suppression and still finding their rhythm again. And this is why I care so much about tracking function and not just your blood work, because you can see so much more. Watch at least for 3 months how your waking temperature is, so your BBT, your daily mucus pattern, and how is your pain and spotting tracking. That tells us far more about estrogen and progesterone, how that all behaves in your body than a random blood test and a random time in the cycle will ever do, because that's just a snapshot in time. And we need to support definitely inflammation and then estrogen sensitive endotissues and helping your natural hormone pattern come back online with nourishment. But so important, liver and gut support for estrogen clearance and regulate your nervous system. Without that, it's going to be so hard in all other areas. So the short answer would be, yes, what you're seeing is possible, and you can have an estrogen-driven condition and still have that dried up cervical mucus for a while, especially after the strong medication. And that's probably the main driver why this is actually happening. Now, your job right now is not to panic about this, but give your body a bit of time and just support. And then we have a look at it and you will see it'll change. It will change.